Hello everyone, and welcome to this audio podcast. This audio podcast is part of the Haemotoxy. This audio podcast is part of the Bostics and Baraga and the Specials. This audio podcast is part of the Express and Caliber, and this audio podcast as part of a Storm Robotics production. So continuing in our works by a science student Hussain from an academic institution in the United Kingdom or UK, looking into sort of the the histopathological tissue processing procedure. Now, in a previous audio podcast, there was in as part of the sort of methodology element is where M. Hussain talks about in as part of the as part of the diagnoses of M. tuberculosis in this patient case from from a from a patient's pulmonary lobectomy specimen is where where M. Hussain informs of where there is a fixation stage in around the staining, there's a dehydration stage in around the staining, there's a clearing stage, in around the staining, the embedding and sectioning staining of embedding and sectioning staining are in around the preparation or basis for histopathological, as part of the histopathological specimen and processing procedure. So, on this audio podcast, a little bit in around elements on these particular sort of elements of preparing the histopathological tissue or tissue for processing. So, as part of the chemical fixation basis, it is used to keep the tissue specimens in as much of a lifelike state, lifelike basis or state as possible. That is to say, then, the viewers and listeners, that in as part of laboratory environs, as far as laboratory environs are concerned, it is where in histopathology, like many other like other sort of environs of laboratory practice, like other sort of divisions or bases of laboratory practice, it is where investigators, healthcare science practitioners, and specialists, etc., look to understand sort of disease or abnormality from normality in so much as where they can where practitioners can inform of the sort of elements of condition or disease process, or even disease process to support a frontline clinician or frontline practitioners to ensure patient care is patient care is made more formidable. So the basis of the chemical fixation in as part of histopathology is where the specimens are placed in a 10% neutral buffered formalin solution. And this is made by dissolving formaldehyde gas in water to create methylene glycol, which forms methylene bridges with amine groups that constitute tissues. This irreversibly then cross-links particular proteins within the specimen. So, for example, in this patient case, the specimen or sample was from a pulmonary lobectomy, and where then it was where the the particular sort of cross links of cell components then are then brought out, or sort of brought out within a specimen together. So that's sort of sort of the initial basis of the histopathological tissue processing procedure. The second part is in around sort of the dehydration basis, which also is where the specimen goes. The specimen or sample is also referred to as the coagulation basis, or where there's a sense of coagulation. So the dehydration process utilizes alcohols with such as industrial methylated spirit, which is composed of ethanol and isopropyl alcohol. Industrial methylated spirit coagulates, sort of brings sort of forms sort of coagulation or coagulates cytoplasmic substances by removing and replacing a water within cells, performing sort of the coagulation or dehydration requires transferring specimens or samples through increasing concentrations of industrial methylated spirit or IMS solution to avoid sort of the shrinkage and distortion, the shrinkage and distortion of the specimen. So, in just to additionally sort of inform is where in histopathological laboratories and sort of those pathology environs, additionally such as cytology, for example. It is where it is very easy, for example, or can be very easy, for example, where specimens can be taken from frontline practitioners, which are then sent to or sent across to cytology or histopathology laboratories. But then what happens is that as part of sort of the preparation of particular specimens and again in this patient case in the context of pulmonary lobectomy, where the patient case was to determine tuberculosis from a pulmonary lobectomy specimen. It is where it's very easy, or it can be very easy to actually see that there are challenges, or can be challenges in around the cell preparation, in around the specimen or specimen or sample preparations, because the specimens themselves are also liable to actually, for example, be for example, where they can be inadequate. For example, where frontline practitioners, for example, when attaining particular specimens from patients or patient cases,